first to start from scratch in Marin County in 25 years. So we did a lot of very effective marketing. And at 1 year, he had 120 patients. And it reinforces orthodontic benefits because people can see, wow, this is what ortho's capable of. It's just much more powerful than just looking at 2 still shots. There's something about video and animation that does that. And the Morse by themselves are great presentation tools. Study clubs, schools, community organizations. My husband takes them on his laptop when he presents to elementary students. Kids think Morse are cool. Obviously, this was dramatic. She was so impressed, she married the surgeon. Dr. Noelle Moser here. Moser, she wants to call hers Mo Money. Again, just that word of mouth, everything that you can do to show that you really care, you're adding value, and what greater marketing than when you really are increasing the quality of your service and the patient care. So how does poor patient compliance affect your bottom line? Out of these things, the most direct impact is on treatment times. Let's do some math. What's the value of 1 appointment? We've already established that 1 appointment has a value of $400. So I'm going to argue that on average we have at least 1 appointment per case that is unnecessary. The rest of this is an opportunity cost. You could actually be making this money. You can either, it could be more time off for the practice, or you can open the chair time and bring in new patients. 40 more new patients for practice A and 80 more for practice B. That translates into $200,000 or $400,000 more income per year that you could be bringing in. This, we spend all this time and money learning new things about the conversion rates, the how to handle our accounts receivable, the clinical aspects, but then we've got this whole group, these patients that we can actually kind of mold a little bit here and have them help us out, and that's rarely looked at. You benefit, the doctor benefits, the practice is making more money, you have less headaches, and you get to have more fun. And the patients think you're cool. And when patients are having fun, you never know what they'll do. A few months ago, we had an adult patient come in. He was so impressed and had such a great experience at Dr. Don's, he decided to dress up for the removal appointment. And a teenage girl, she decided her t-shirt would be better suited as a purse. She made that and wears it around town. We heard about it from a friend of hers before she even came in the office. She'd been wearing it for a month. What is marketing in general? The business activity of presenting your products or services in such a way as to make them desirable. But there's all these avenues to marketing. We've got practice identity, promotional products, public relations, networking, and advertising. These are all the different avenues you can use to market your practice. Marketing is a continuous year-round venture. Office technology, this is also huge. Yes, it's an expense, but it's really important. Patients are very impressed when they see you're keeping up. And if you want to differentiate yourself from other people, this is one really great way to do it. Anybody dress up? No? Have one staff member dress up as the Tooth Fairy. You can find all sorts of fun fairy costumes online. The whole wings, the whole bit. Ask for referrals. Do you all push that in your office? It's so important. It's so easy. They're right there and they're happy with you. Build a strong identity, educate the community, support schools, sports, and youth organizations, network through local business and dental groups, and advertise with integrity. Those are the keys for successful practice marketing. And success requires vision, right? You gotta have a vision of what you want, what are you looking to achieve. Well, success isn't a result of spontaneous combustion. You have to set yourself on fire.